All right, hello everyone. It is March 17th, 2026, and I'm gonna welcome you to the Medical Cannabis Policy Advisory Board. Start with the welcome script. Every proposed, is this right? It looks shorter. Okay, there we go. Okay. This meeting is being held virtually and in person and is hosted by the Utah Department of Health and Human Services in Salt Lake City. Public notice of this meeting was provided on the Utah Public Notice website. This meeting is being recorded. A recording of this meeting will be posted to the Utah Public Notice website no later than 3 business days following the date of this meeting. Every proposed agenda item must have a summary of the topic submitted no later than 7 days prior to the board meeting. Board members will present and discuss the summary. If no written summary is provided to board staff, the relevant agenda item will be removed from the agenda. Only items that have been submitted in writing in advance of the board meeting will be allowed during discussion by the board chair. Public comment instructions. Public comments is limited to 2 minutes per person. If you want more time, you may request it from the chair. Please state your name and your affiliation. Only comments made on items listed on the agenda will be considered. Public comment instructions, how to make a comment over Zoom. When the chair opens public comment, use the raised hand icon on Zoom to indicate that you would like to make a comment. When you are called on, you will be taken off of mute. Take 2 minutes to make your comment. How to make a comment in person. To sign the public comment sign-in sheet with your name and indicate what agenda item you would like to make a comment on. The chair will indicate when it is time for public comment and invite you to the table. Take 2 minutes to make your comment. For additional information, to make a suggestion for agenda items or to contact board members or staff, send an email to dlbcboards@utah.gov. And with that, we will get started. Has everybody got a chance to read the February minutes? And did everybody see them? Any changes you would like to make? If not, can I get a motion to approve?
A motion to approve. I'll second.
All in favor to approve the February 2026 minutes? Say aye.
Aye.
Any opposed? Okay, that passes unanimously. Administrative business. For me, all I was wondering is, have we decided on our new medical professional on board?
That is pending.
But we have a lot of.
There's a great group of applicants, very
I love
difficult decision to make. And it hasn't been made yet. Yeah. But thank you for those that spread that word. It showed that we got a good group.
I got a lot of people in, like, when I said it, they're like, oh, I know a doctor, and then I actually sent you a text, I was like, I keep hearing really great things about people, like this one, I forget their name now, but people, I've heard it multiple times in a week, they're like, this person applied, and so.
Yeah, and one thing we like to emphasize is that even we can't choose everyone. But those that we don't choose, we would love them to be a resource to the individual that we do choose and to be ongoing, providing input. They stepped up and were willing to apply, and we want to make sure we use them in the future.
I feel like we need to move on the subcommittee thing, and we started them for a couple of these positions before, and having a subcommittee of interested positions would be, I think would be amazing. So, I don't think there's any other administrative business unless somebody has something they need to bring up. Everybody's eyes are down, like the first day of school. So with that, then we'll move over to agenda item number 4, the DHHS and the CDAP update. We can start with Rich.
Yeah, so I already updated you about the status of the medical provider vacancy on the board. There was a new DHHS online training course for recommending medical provider proxies that was launched during the past or earlier this month. That went live just at the beginning of the month. And Utah law requires that the proxies complete training related to health information privacy practices. And so the purpose of that online course is that they learn it and then demonstrate that they learned something by taking a brief quiz. And yeah, and that'll only be taken when they're reapplying for reapplication or with the first time they're getting it. So everybody is not required to take it that currently has it, their proxy card right now. It'll take 2 years in order for that to rotate to everyone that has a current card. So over time, everybody will take it, but it'll take about 2 years. So yeah, we worked really hard on that, felt good about it, got some input on it, and that is now launched. Also, Dr. Matt McKiff presented at the Utah Osteopathic Medicine Association Winter CME Conference in Ivans on February 27th. And we were able to share handouts related to how to recommend medical cannabis to patients, and also just the basic information about the program at that event. And feel good about the ongoing sharing of information about the program from Dr. McKiff. And then the next time they'll be presenting is in May at the Ogden Medical Surgical Society meeting. Just some general stats about the program as of like the end of last month. We reached 110,487 active medical cannabis patient card holders. That's an increase of 1,600 from the month before, which is notable. It's a bigger increase than we typically see from month to month. And then in regard to the number of recommending medical providers in the program, we did see a slight decrease in that. That jumps up and down as people's registrations jump up and down. But anyway, we're at 1,022 right now. And then 96 pharmacy medical providers or pharmacists participating in the program. That's an increase of 3 since the last month. And that's all.
That's awesome. Said 110,000, right? But
Yeah.
are we still seeing about half of that purchasing?
I don't know that off the top. That sounds right. I can get you that stat later,
Yeah.
but yeah, that's what the trend is. Is that, yeah, we see about half are making, or actually I just got confirmation, 55% a month purchase. We've got some great staff that have the numbers in front of them. Awesome. Messaging, right? Thank you.
Yeah, dang it, I would love to see that number go up.
That's active patients. Yeah,
I mean, not that I need them to be purchasing every month, but when they're not purchasing at all, then you have to assume they're not purchasing in the state. Okay. You're done?
yeah,
Did you want to?
Sure, we don't have a whole lot today, wrap up session, I think we're gonna talk about a lot of our meeting stuff here next second. But we do have another pharmacy opening up this year in 7th. Or before the end of the year, we are not planning to post it immediately, but we'll probably have that out next 2 months. And then, we just still have a firm date for the ICS launch, but we have one of those hopefully soon.
Yeah. Okay. Any questions for them? Okay, then, we're gonna move on to number 5, and I have asked Nanette if she wanted to kind of lead the discussion on the legislative session review, so her and I will kind of tag team that, if that works. Yeah. Just because I feel like I talk all the time, and I feel like I've said these all 400 times.
Well, I think, yeah, you're the better one to say those things, so, yeah, I guess just start with, House Bill 389, which is the medical cannabis amendments. Which is the biggest one that doesn't, I mean, it affects us, but
Yeah.
not a whole lot. You wanna go into it?
Yeah, so, and I believe was this, I'm trying to remember off the top of my head, but JD, was this the one that had telemedicine in it?
Yes, it did.
So that was, I think, our big change. Things changed from the last time we talked about it. Just mostly that, now you can have the low THC products are now legal, which we were doing anyway, but, so those kind of things stayed, but we lost telehealth in there, which was something I know that everybody had kind of, liked here. I mean, I feel like I don't need to go through and read everything again. I know you guys have read them. Is there anything you guys want to discuss about them?
I had a question for Brandon and Cody just about the $15,000 third site. Cause that doesn't affect the total amount of grow you can have. You can just have a third location, right? To get that grow.
As far as the policy advisory board moving under UDAF, do you guys envision that as the transition takes place, we will start to meet at a different place than here, when we start meeting at your building?
Yeah.
So our meeting in May will probably be going to Taylorsville instead of here?
No, I think
Or will it be, there'll be the one in January of next year?
we're planning to go live with the transition, have everything finalized by July 1.
Okay, so the July meeting will be there. Okay,
Yes.
it's good to know.
I mean, I guess. Maybe you could take a minute to just explain all of the things that will be changing as far as.
Yeah.
I mean, this looks very simple on paper, but
Yeah, the goal is to make it as simple as possible for this bonding. There shouldn't be a whole lot of changes other than the location where we'll be.
what about for like industry? What about with like, who's gonna have the biggest?
Industry already is all under UDEP, so there shouldn't be any changes there. And we're bringing over the staff who work on the patients and the recommended medical providers, so really, we're hoping that nobody will really notice a whole lot of change outside of the agencies.
Then you guys just. Don't come over with them, so are you just like taking a break? Like Sabo or, yes, that's what.
I think the biggest, and not necessarily changes is just new aspects, as Brandon mentioned, right? The HHS staff is gonna be coming over to UDAP and will be handling what they already have been handling, right? All the boards with the CUB, obviously the MCPAB, the licensing board changes a little bit, right? There'll be these 3 new directors, and I think that's where the majority of the change or the new things are, is these 3 new directors that, again, will be not just the cannabis licensing board, but be the specialized products board, has a whole lot of duties that they're gonna have to deal with. For instance, any time that either medical cannabis industry or even kratom or hemp actually challenges, they'll be the hearing officers there as well. They also will be having set a way for patients or the public to come to them and talk about, their issues, maybe, I think they'll probably end up setting a very big help to the governance board as far as getting some other changes there, as far as, what's some more allowable medical reasons to get your card for, they're gonna have to, again, work with the CUB, but they're also gonna have to set up a way for the public to come to them and talk about that. I think that's where you're gonna see the biggest change overall, is with this new board and the amount of work that they've got.
And are they gonna be the ones to help administer the new licensee for the pharmacy?
Yeah, they'll definitely be the ones who get to make that decision.
And you talked a little bit about this, but on the qualifying conditions front, it talks about them having a process. So that wouldn't be through formal rulemaking by the department, right? They're just gonna have to create
Yeah, not the way that I read it. It sounds more like it's gonna be a way for them to gather information, and obviously, right, they're gonna be working with industry in different ways and with, but it almost sounds to me like they need to have a way to provide. Lack of a complaint form, right?
Like there needs to be an application
Yeah.
process so people can understand what is going to be
Yeah.
considered enough to submit an application? Because I can see people submitting, and if it's not a formalized process, them saying, oh, just like they say to patients all the time, oh, I'm sorry, you didn't submit enough. Oh, you didn't clear this hurdle. So I'm very interested to know, how that's gonna be formalized, because if it's not gonna be under rulemaking authority, I worry about the urgency to do that. If it's not, if it's not required, to be done by a certain period of time. And if it's not formalized, I worry even more that it's gonna just be a game of move the goalpost on being able to,
Yeah.
to get an application in that will actually be considered. Because if you're like, hey, you have to provide this certain amount of evidence, or you have to provide, these types of research, articles and things like that to be able to get a condition recommended. Because look, I think this board, recommended for something, much stronger, and obviously that didn't make it into the legislation. But what I worry about is this being more of a symbolic change than an actual change. Because in going through all of these bills, while there are some things that do push patient access forward, I think this session was far more about like regulatory structures than increasing patient access. And so this is one of those that I hope, so just some feedback for you all as you guys can integrate that new licensing board with the CUB with you, that's an important thing. And, I think part of it is seeing if that's going to be a workable way to actually add qualifying conditions, or if it's just going to be more of a symbolic avenue than anything. So just kind of just feedback for you all, not saying like you have to do this, that, or the other, just kind of what my concerns are about it.
Yeah, the way I read it, JD, is that, obviously the board will be overseeing the CUB as well, right? So they'll be able to kind of say, you guys are doing your job, maybe you're not, as far as the board is concerned. But I don't necessarily read it in a way that says that, the licensing board gets to make a decision on if people get their card, I think, but.
Oh, of course, because it's just gonna be a
Yeah, they'll be able
recommendation.
to recommend to the
Yeah,
lawmakers
certainly.
that, hey, let's add this to the list.
So does that mean as we come up with recommendations here, we should be taking it also to them as well?
They will actually be overseeing you guys, really, that's, I think, right, I mean, to some degree, we'll still be on this type of thing, but they'll obviously be a part of that as well, so like your recommendations are definitely be heard directly by them.
Because, so this was part of my comments last time we had our meeting, is building a synergy about how we think about moving forward with between the departments, industry, patients and everything else. Because the board has made recommendations a lot of times to legislators, and obviously almost none of that got in. And a couple of the other things that got recommended got pulled out of bills late into the session. That's politics, like that's okay. But, all of us just spitting to the wind doesn't move things forward in a way that's productive. And so making sure that we have some alignment there, I think will help move some of these things forward. Because from what I hear also, a lot of times, at least what I heard a lot from legislators this time was they were pro certain things, but they didn't feel like they had enough consensus
Yeah.
from varying groups to make sure that they wanted to include that in some of their bills. Well, how many groups are they talking to? Because at the end of the day, really it was health, ag, probably us, and maybe a couple other, a CUB maybe, right? But they shouldn't be going out to the universe and being like, well, what do you think, Joe? Like, really, there's only so many recommendations that should be getting made anyway. And so I was surprised at how much disharmony what there was in this last session between what I was being told versus what I understood was actually happening. And look, that's just politics too. Like,
You and me both, brother.
yeah.
And then another clarification is in terms of the Center for Medical Cannabis Research and its newly formed Medical Cannabis Research and Education Committee, which used to be named something else, who is actively going through the literature and making recommendations on qualifying conditions, routes of administration, et cetera. Do they also now funnel through this new board? Or, okay, so I think a flow chart would probably.
Yeah, I was gonna say.
Grab a whiteboard marker. Cody, let's.
Yeah, just one big blob of.
Yeah, we'll just put a bunch of names.
But I
Okay.
agree with Blake that, it would be nice to somehow have consensus from the different contributing factors. So that we're at least aware what the left and the right hand are doing. It would bring more unity as a whole within the state to the program, in my opinion.
And even if we don't agree, then that's okay too. I just know who I'm disagreeing with, right? Versus the universe.
Well, and it might foster a better understanding of what the rationale, if there is a disagreement,
That's right.
what's the rationale for the difference? So just a recommendation.
Will the newly formulated licensing board go live, are you planning for it to go live July 1st as well?
We would like to, but we
Okay.
are doing a competitive recruitment for it, so. Those can always be challenging, but
Of course.
we intend to, yeah.
I'd like it by June.
Let's have a mixer.
I see. ICS or board, which one comes first? If you made me choose, I would have said the same thing.
He'll say differently.
Well, of course, of course. Whose project is it? Right?
Maybe circling back, DHHS's involvement after July 1.
So, no, all of the, functions. It will be going over, so Center for Medical Cannabis here will be closed.
Okay.
We are absolutely, we help out our sister agencies all the time, so we will always be here, should there be questions, should there be. They want some, expert input on things, we do that regardless of what. Policy may be there and what statute, but I think our formal role will be, as long as we hit that July 1 date, which is the goal, will be transitioned out.
And
So
Rich, Trevor, are you coming with?
I am not, but everybody else is.
Okay,
My plan is to.
okay. Well, you're the one I was concerned about. So, I'm just kidding.
So originally when things were being talked about too, there was some talk about Department of Ag doing contracting with the health department. Is that still on the table? Or are you just bringing over the appropriate people so you don't need to do that?
There might be certain roles, like Shannon was talking about, like the epidemiologists, for example, who are doing research that we would still work with them on, but all of the day-to-day functionality is medical cannabis program is.
I like weird stuff, so this is.
For the uniform transaction fee, is it going to go back to $3? Is it gonna go to more than $3? What's the-
We anticipate it going this way.
To the $3? And then remind me again, were there changes on what that can be used for? So it can now be used to enforce all specialized products, right?
Yeah, so it'll pay for the new board, it'll pay for everything that is already under 23B by the HHS statute. It does have an ability to help with kratom and hemp with the new specialized products aspect. There's a new complete law that was put in place based on JDB's HB85. Research is something that's part of that, and then also the nonprofit to help certain patients out too, so all of that would be funded out of the portion. It's still $1.50. They separate the two, the secondary $1.50 you're just talking about, when we go into the production establishment fund, it's still to stay with agriculture, they don't think they have.
For sure. In addition, like for kratom and hemp, are there other sources that will go to enforcement as well? Because I'm sure some patients are probably listening right now wondering why they would be funding enforcement of products they may not use.
Our intention is to have those programs fund themselves long term. It's just a matter of getting.
So there'll be multiple sources of funding for those
With
things.
HB 385, it seems that it's gonna be something that helps out, but I think with that, so hopefully it's very nice.
Well, my hope is, so one of the things that I was most impressed about from all agencies involved was there got to be a point after everything was established where the fee was assessed and it was decided to be too much. Things are being reestablished again, so we don't know exactly how much of everything. With the hope of enforcement, we should see less hemp violations, we should see less of everything, and this is kratom ultimately will sunset. That should cost less and so forth. So I hope we'll be able to have the departments reassess how much fee they need going forward after it's established.
We do usually the assessments that go to the legislature, so rest assured that will happen.
And that's a positive. You guys did great about that. You guys have looked to try to help industry because you understand what our tax burdens are. And so it's appreciated. So thank you.
Okay,
We move on.
yeah, I was at 121 now.
Yep.
So this one does create the voucher program, and that will just be taken from that 150 that's given to the DHHS. And 300,000 of that will go to a nonprofit that does a voucher program with, Medicaid, Medicare patients. To kind of cover the cost, to get those patients to shop in state. It removes requirement that cardholders transport in or publicly possess the cannabis in the bag that they provided at the pharmacy. So that's, I mean, that's good. It still has to be in something opaque, but it doesn't have to be in the original one. You can tribal IDs. It repeals background checks for caregivers and guardians, which I think it looks small, but I think that would be a huge help to a lot of people. Allows guardian card eligibility. Again, those look small, but to me, they seem like they could be really awesome things for families that have those types of patients. You can use other forms of remediation other than radiation approved by UDAP. And it removes the need for the Division of Finance to approve payment providers. So I think that one was, any questions on that one? I think we all feel like we've talked about every line on these for weeks on end. So we'll see, maybe there'll be comments, I don't know about.
I do have a question with the voucher program, with DHHS, soon to be no longer involved in medical cannabis, regulation. How, they're not gonna control that fund anymore, right? Obviously, the fund that this money would come from comes over to you all. How's that decision making gonna be made? When DHHS is no longer gonna be involved in regulation, how are they going to make decisions over funds that they no longer even control? And because they control the fund, right? And they have rulemaking authority
No.
on effectuating the voucher program, right?
The
You guys
whole fund
control
goes over-
so they control the purse strings. You guys are just gonna make rules around the voucher program itself. I mean, that's the way this reads.
The voucher program would report to DHHS, right?
Not long term. There were coordinating clauses put into these bills.
Got it, okay.
So that if the 389 passed.
Oh, that's right.
So it's coordinated that ultimately when they get put together, everything.
We'll move
in
over
the
to
voucher
that.
program
Okay.
will go to you now.
That would have been very.
Yeah.
I was just thinking of someone else's problem. Okay, SB 66, the medical cannabis pharmacy license amendments. Again, it just reestablishes rulemaking authority for UDAF and creates those regions. So we're not having people moving where it's convenient, but staying where patients are needed. So to maximize access, so.
And
Those
the
are,
regions will all stay the same that you guys have already established.
yeah. So those are our bills. If you want to see if there's anybody online that has any questions about any of those. And then we can move on. Okay. Then our next one is advisory board goals. It says it's me, but it's Blake. So
It's me?
yeah,
Dang that.
you're Mrs. Hennessy today, so
That's why you were so anxious to have him show up.
Oh, Cause I've been super sick and I actually called Nanette on Sunday and I was like, I just looked at, and I don't remember what I'm supposed to be doing for advisory board goals. Like, I need to know right now. And she was like, oh, no, Blake's doing. I'm like, that's better. That's.
It's me. It's okay. I was the one who, kicked the hornet's nest last week.
Well, take it away, keep kicking.
Well, so just as the general concept, in case anyone forgot, so I serve on a couple medical cannabis policy advisory boards across the US. And every one of us has, similar to here, experts with particular areas of expertise and different things. And one of the challenges that I've encountered in a lot of boards is everybody with their own expertise has a stint about what they sort of think needs to happen for the cannabis program. The purpose is less about that. The purpose is to provide your expertise to help get a consensus so the board can make decisions that will ultimately lead to recommendations that are probably good for the patients and good for the program. So we have painstakingly in a bunch of these boards now created goals that we put as a lens for all of our decision making to go through sort of that lens. And it's been extremely helpful. It's made our meetings way more efficient. It's, because when an issue comes up, we literally say, well, does this align with what we're trying to accomplish this year or not? And so forth. And so I reached out to several people and it was good. I had productive conversations. I think it's actually better for us to sort of have a talk generally amongst all of us here about what you would like to see as some of our goals. And we may not get full resolution on anything today, but I would like to start hearing what is it that we want to get out of this? And what are we actually trying to accomplish for patients as well? So I'll open up and just say, one of the goals that I have is to formulate a way for us to think about pricing that will be good for patients. And so as an industry representative, we have constraints, and JD and I have probably the most knowledge about how it costs and what it costs for us to be able to produce products and so forth. Having said that though, how can we uniformly streamline things that are going to be in line with patients? For example, okay, we're increasing the fees. That's bad for patients, right? At the end of the day. However, once it's established, we were able to reduce fees as we went on. And so it would be in the interest, in my opinion, for this board to continue to harp on Department of Ag. How are we using those funds? Are those funds, necessary? You need as many funds as you have. Are we able to start pulling those back? And that's just something we should be looking at as a board and how we think about funding. So real time example of sort of what I'm thinking about in terms of funding and goals. Research may be something on Misty's mind and how we think about research. One of the things that I think has been extremely frustrating is the research body has not engaged with us. And I have actually reached out to Misty a couple of times to see if they would be willing to engage with us so we could have alignment. They have had, I don't know if interest is the right word. They have had logistical issues that have not made that possible. So maybe we should be thinking about how we think about research and so forth. So anyway.
Or building bridges, because I think a lot of it is the timing of meetings. We're currently, for example, the MCPAB board, the Medical Cannabis Research and Education Committee is meeting on a quarterly schedule, which isn't a lot of meetings at the end of the day. So, it's building bridges to have a better integration between the policy advisory board and other members and perhaps other committees at the Center for Medical Cannabis. It might not have to be MCRAC. If there might be a subcommittee that could be formed that could meet on a more regular basis.
Yeah.
To kind of build those bridges.
Because it seems silly to me, by the way, you're doing more research actually on cannabinoids than anyone else I know up at the U. And we just completed a study. And so like, I probably have more research than almost anyone else going up there right now as well. And so the fact that we have no insight into anything that's happening that side and vice versa. Because why would we, electroshock therapy, for example, you know, in rat models, why would we duplicate or triplicate that if there's data available? So.
Pricing and research, access is another one that is, I came into this board not with a lot of, no really preconceived goals. But as I've been a part of this board, these are the kind of things that I have grabbed onto. Maybe not as much as the research side, that's not my background, but this pricing, again, none of this has really been my background, but I do like to participate. But the pricing and the access, and I think, we've had a lot of good examples over time of improving access. And so I think that would be another goal, is increasing access or improving access.
I like to lump those under facilitating research, and I think that we worked with UDAF previously to change some of the regulations in order to in hopes of improving access to products. But that's still an imperfect solution because we have reached barriers even with the changes that were made. Both from a regulatory standpoint, but also from a cost perspective for the researchers. So there's still improvement needs to be made there. But I like to lump all these things under facilitating research and education, because not only do we need to improve accessibility of the researchers to the products to conduct the research, but we also have to improve the public's access to the research that's going on to generate support for that research. And, these are all achievable goals. It's just gonna require a little bit better communication, I think.
I think that ties well. Another one I think that we've talked a lot about is safety and quality, being incredibly important. I think that ties right into this.
I think safety and quality is a real strength of our program.
Mm.
I think it's getting the information out about how good we do.
Education,
That again falls under education and accessibility.
yeah.
So
I mean, in my opinion, I'd like to see that number, the 55% of patients in the program are only purchasing. That's my number one goal that I would like to see, that increase.
We do.
That's
You
a
know
good,
they need
very
it.
measurable goal too.
Yeah, I would love to see, like, I 100% agree. Like,
Question, Annette, do you think that education is a way to improve that?
Absolutely.
And then,
I talk to patients all the time that don't even know what a COA is. They don't know what a terpene is.
so then my next question is, how do we education? How do we do some of this education? Because here's one of the things that's interesting. I mean, we have lots of information about our products, and I think generally, I mean, the labs also have probably more knowledge about almost how any of these cannabinoids work than almost anybody. Putting together education should be easy, but how do we actually disseminate education to people? Right? And I don't think it's a billboard. I just don't think that's the way to think.
It's probably not a medical journal.
well, the media's not getting very far.
Something we've been trying for, 2 years now, building community and getting it that way, but it's something that needs to be brainstormed from every angle here.
So you think with greater education, people won't care as much about the price of the counter?
I think so.
Interesting. Because ultimately, that's what you always hear, right?
Yes,
Like every time
It
you
is
all post as a coalition, it is the first 35
100%.
comments. I actually saw that you posted the
Today,
agenda
Did you?
and someone said your prices are disgusting.
Yeah.
And look, when you
And they
compare
are.
it, when you compare it to markets, around us from an adult use perspective, yes. But are there hidden costs in that as well? For sure. But I think one of the things we should be doing is we should be keeping tabs on where pricing is going, nationally. When's the last time we studied that? 2-3 years ago, Rich? Last time it was presented at the legislature, right? I think
Yeah.
we should be keeping some tabs on those things, but ultimately, I hope with Schedule 3, hopefully at some point, obviously the federal government has a few other things going on right now. We don't need to speak about any of those, but there's a few of them. The question is, when does that happen? And I really think there needs to be a real and honest conversation that when that does come to pass, how should our program look from a regulatory perspective? Not just for operators, but for patients as well, right? I go to Walgreens. I do not have to present a medical card at Walgreens. I generally don't have to present my ID. right? I don't have to go through a vestibule where there's a security guard there. I don't have to go into a very specific area to get my medicine. I don't have to sign my kid in as a visitor. I don't have to sign my significant other in as a visitor. And if my significant other asks me a question about the medicine that I'm purchasing at the counter, they don't have to be told, hey, you can't have those conversations because you may divert your medicine to your significant other. All of the other things from a production standpoint, I've read, what applies to Schedule 3 producers. I understand. There's probably not a ton of movement, there, but it's the death by 1,000 cuts for everybody, right? So you layer 280E on top of all of this, and I think people probably look at what it costs at the counter and they think that people are just running it up. Less than 25% of cannabis businesses in America are profitable. And I'm not here to whine and cry and say like, oh, woe is us. Look, we chose to get into this business. We knew what the game was that we're playing. Hopefully the alleviation of the tax burden will be significant. It's unfortunate it won't be retroactive because a lot of additional people will die on the vine. But we should be making it easier to be a patient. And I think that's why this session, while there were some good things to preserve access, right, to low THC products, while I'm really excited for the potential for the voucher program and some other things, this version of qualifying conditions that we got, look, I'll reserve judgment, but my idea is I don't think it's going to go much of anywhere. It's why I had my questions earlier. As far as, telehealth and things like that, can you believe that I've heard a story where someone had cancer and they were going to their cancer doc and their cancer doc told them, you really should look into medical cannabis. They're like, oh yeah, I had a card. I need to get it renewed. And the person they referred them to said, oh man, I'm going to have to see you in person to be able to renew that card. I just think that we are letting this idea of like all the potential like bad things that can come from cannabis get in the way of progress. Now, I'm not saying we just open the floodgates and it's Katie bar the door and we make, cannabis just freely available. It's got to have regulation. And I don't think anyone in industry, and I don't even think patients would say that it should be just completely free and wide open. But we continue to just stop short of some real programmatic changes that could make a difference. Telehealth will make a difference. It won't just make a difference for rural patients. It will make a difference for everyday patients. And if what you're really doing in one of those visits is simply confirming a prior diagnosis that another doctor has made, or you're taking an oral history to say, hey, you suffer from pain lasting longer than 2 weeks, there should be a way for doctors to be able to do that. And I watch around the country as programs start to expand, right? And these decisions that are being made. I saw there were a couple, one or two states recently who are going to allow it to be, in hospital settings, in terms of end of life care. We talked about that, right? Has not gone anywhere. I think that is, to me, one of the ultimate barriers we face. And I understand this stuff is incremental, but we have been lobbying for the same programmatic changes for how many, 3-4 years now, with the work I do with Wholesome Co. And those things get left on, they either never make it or they get left on the cutting room floor. And so I think it's so hard to say to patients, like, your access to this program is being pushed forward. And I think it makes it even harder to probably stomach the idea of what the cost is to go and be a member of the program, especially when there's a perception that I can simply just go across the border and get the product more freely. I can get the forms that I want. Not just smokable flower, but I can get, other forms that I want. I can get it at a potentially a lesser cost. It makes it, I just think if we were to do away with some of those barriers, I think it makes it then easier to focus on how do we continue to get costs to the medicine to come down, because I just think if I'm a patient and I have any questions and I'm like, oh man, we just added another fee. What am I going to get as a patient from that? Now, you may get things. It's just hard, I think, to see. So to me, this is my long-winded way of saying my goals for the board are to see us reaffirm prior recommendations that we've made, not just say, hey, we made this recommendation 2 years ago, it didn't go anywhere. I think we need to be, putting those back on our agendas. And look, I think it's as easy as just putting it on the agenda and taking a board vote to say, hey, we revisited this, let's make the recommendation again. I think with this new licensing board coming on, I think we need to figure out a very specific way to be tapped into them, especially if that's going to be kind of who oversees us. And now they're going to have involvement in rulemaking and policymaking. I think we need to have a way for our recommendations to be heard by them. And I also think that we need to have a way to be better connected to the governance working group beyond you all just being asked to come and testify a couple times a year at a hearing, because this year, and even to an extent last year, I feel like cannabis moved more without involvement from, you know, industry and from, you know, from these types of folks around this table. I think it moved more based upon how the lawmakers wanted it to move. And I'm not saying that's altogether wrong, because I know they have their own visions for the program. But I just feel like the conversation, it used to be a little more holistic. Seems like now it's becoming a little more siloed. And I just think that without our voices trying to push those things forward, it concerns, you know, it just concerns me that we are going to see more and more sessions go by where we're making, you know, regulatory changes. And look, I get that there had to be some responses from a regulatory perspective this year. But again, those things that I think could have most moved the program for patients based upon what was like in front of lawmakers, telehealth and disqualifying condition stuff. You got what? I don't even know if I'll say you got half of one. You know what I mean? You got a quarter of those two, you know, ideas to get across the line. So I think we have to figure out how we reaffirm those things. But also another thing to think about is how do we approach lawmakers to say, hey, this is what we would like to see. This is our recommendation. What issues do you have with it? Because I think sometimes when you say, hey, I want to make this big programmatic change, everyone's like, oh, that seems really, really big. And I think we have to walk it back and piecemeal. So I think when we reapproach our prior recommendations, we should think about maybe what was problematic for lawmakers with it and try to refine it a little bit. And then ultimately, if we think it's already been refined enough, again, we'll just have to, you know, continue to fight the battles.
So Desiree, how hard would it be to get onto the working group's agenda?
It's
on a
not, it's not hard at
regular
all.
basis?
And honestly, that's what, the lawmakers, as far as reaching out to them for a phone call or, an update or, you know, just talking about things during the interim is actually really easy. What I have found, and I don't think it's any fault of their own, like, I think it's just they get really busy towards the end, is you can get a lot of yeses during the interim that then when they're kind of, once we get to the session, they kind of prioritize their needs, not just with cannabis, but with other bills, right? Like what they're gonna be asking of their peers. And I think cannabis, things kind of filter out a little. And so what I think Nanette and I need to work on, and then, you know, as we change board chair and vice chair during this year, then that, you know, those people need to work on is making sure that we are a little bit more aggressive forcing this through the finish line. Because a lot of the things we talked about was like, yeah, that sounds great. We don't have any problem with it. But then actually getting it in a bill, it was prioritized later than other things, not necessarily about cannabis, was my feeling.
Well, yeah, I mean, this is why, though, it's important to probably have as an agenda item, an actual presentation from us to the working group versus, because here's the thing, we all have individually met with individual
Yeah.
legislators, and that's a very different conversation
Yeah,
than
and if
when it
we,
hits the committee.
if we did that twice last year, if you go back and you look at the videos of us doing it, it's pretty clear the things that they're like, hey, we like those things, you know, can we break those up and see what bill they go into? And then they didn't happen. And so we need to figure out the disconnect there. And maybe we need to just sit down with lawmakers before November, you know, and just say, let's get some words written down for the bill.
So where I've had success in other states is typically after there's consensus on one of the committees. You then go right to the people who are actually writing it. You were there, you heard it, we all have consensus. Now let's start putting it together.
And just
in
stick the
bill.
draft
And
attorney
because
in
they're the
it.
ones who write it anyway. I mean, let's all be clear, right? Like,
Yeah, and I think that's what I'm saying. We need to figure out a way to turn those yeses into actual bill language. And I felt really good going into the session. You know, some things fell through the cracks, but a lot of the things that were talked about just didn't get implemented. And so that's what we need to be better about that. I'm hoping that the working group kind of can be an ally in that. We'll see, but maybe there'll be another good voice for us.
Yeah, I think we should also develop a strategy for the session. Obviously, we have to be very cognizant of not holding a meeting, impromptu, by too many of us talking about it, but finding ways to support, you all or whoever is the new, board chair and vice chair. Because I think that's where a lot of it comes down to, right, is during the session, telehealth was in a bill. Telehealth passed a House committee. What was it? 9-1?
Yep.
9-1. And then within a week to a week and a half of that, it was completely removed from the bill by the sponsor. And I'm not, by saying that, I'm not saying that the sponsor, that's not what I'm speaking about, like why the sponsor did what she did. She clearly had her reasons, and that's her prerogative. But to know that this board recommended it unanimously, to know it passed a House committee 9-1. And then to not even see that floor amendment go to a vote, I would have loved to have seen that gone to a vote. So what I want to figure out is how can we be better during the session? But how can we also figure out ways to do outreach to other lawmakers beyond just the cannabis working group as well? Because I think a lot of lawmakers just generally rely on the cannabis working group to carry the water.
Yep.
And as long as it doesn't sound too, controversial, doesn't sound like we're expanding the program too much, they get all of the trust. And I'm not saying we try to create distrust of the cannabis working group, because they do some incredible work and they've done a lot of incredible work over the years. But I think we have to find a way to broaden the conversation to other lawmakers too. And so maybe that is part of the sessions we start to have. I mean, look, it probably speaks to the idea of a government affairs or a, policy affairs, subcommittee or something like that, or it becomes an agenda item that we kind of go out, we talk about each month. Because I think when we talk about agenda items, right, if you think about the real big ones, I mean, other than would we support an adult use campaign, would we support smokable flower, some of those things that are probably either way off in the distance or unlikely, I think this group has covered a majority of the really kind of hard hitting topics in a lot of ways. Now, I'm not saying we don't cover those topics at some point. We may be interested in that, but knowing that we're probably going to have time in our agenda to do that, instead of being like, hey, next month, what do we want to do? Instead of that just being the focus all the time of like, what do we add to the agenda? I think we need to have a 12, a year-long program and focus on how we are going to get those recommendations through, because we make great recommendations. I quite frankly, on the qualifying conditions, y'all surprised me. I thought that the board would go a little more of a conservative route on that. And I still believe that was the right recommendation in the end. But that recommendation didn't even really have a chance to make it in the bill in that form. Right? So how do we take our recommendations from here and get them into the bills? And I think we have to create not only a process for that, but a true roadmap of like, what other lawmakers can we go and speak to who might be sensitive to our position? Because then they can have conversations on our behalf. And it's not just you all trying to do it during the session. It's not any of us doing it independently, or through our own lobbyists and stuff. I think it would create a more united front.
So I'm in agreement with every single thing that JD has said. I want to take just a step back a little bit. So when we talk about goals, we're talking about strategy versus tactics. And does everybody know the difference between strategies and tactics? Tactics are the like daily thing you're trying to engage. JD's talking about how we actually get some stuff done. That's a very tactical way to start thinking about it. Goals are more of a strategy in the way that we ultimately start prioritizing the way that we start thinking about things. And so I think there's definitely, based on what JD said about reaffirming past decisions as a goal potentially, I think that now starts the work conversation about how we start to engage in the tactics. But what the point of discussion around the goal structure is, how do we start thinking about how we strategize in our decision making? I mean, so right now I have 6 goals that I've heard so far. Really, we should only have 3 or 4, most likely. And so probably next time for the next agenda item, we should send out the list of the goals that we have, we should have a discussion point, and we should probably vote on what goals we want to actually set for our group. And then that should start to inform how we think about moving forward.
And I think you can have this conversation almost once a year. Of what do we want to accomplish as a
100%.
goal this year? And that's where I started getting, when we're coming up with very specific, to me, that's much bigger than just saying, gosh, access is something that's important. Let's talk specifically, if it's the reaffirmation and coordinating with relevant entities, the list and the presentation of that information, that's an actual thing, right?
Agreed. I think that's really interesting, because so back to Ned's point of education. It actually, JD's reaction was exactly my reaction. Do you think people would pay more if they were educated and understood? And when the answer was yes, look, you're in a better position than I am to probably know that. And I was actually just floored by that. I was like, well, that makes sense to me, but putting that into a practicality, which means education is good for industry, patients, and everybody to know that.
Mhm.
And the proof in the pudding is, as I've been doing a bunch of this across the country, there have been universal changes that have been happening. One, almost all of them are starting to release their potency caps. They're going away.
Yep.
Two, they're starting to demand quality and testing for all synthetics. This is now becoming common across the country, which is fascinating because you watch almost immediately half the industry dying. They can't seem to produce things without synthetics, right? And so that's for medical programs, not recreational programs, but we're in a medical program. So the trending is all moving. And I think we've done very well in Utah that way, right? But to your point, education, well, why is it so expensive? Well, we do more testing than almost anybody. You know what? We do not get some of the same advantages that some of the recreational markets do.
You
Also,
get
we don't
labeling.
happen to have fire retardant in our flour. Like,
Well, you get labeling if it's remediated with radiation.
right.
That's something you don't get in many markets.
Yeah, that's exactly right. And so this is good for everybody. So, sort of back to JB's point as well, is like, these have abilities to help us move forward. And there is data out there that shows that medical markets are moving in particular ways. So what is it we're tackling? Education seems really valuable. Reaffirming past decisions, to JD's point also, look, this group has tackled, because I haven't been on the board that long, but I've been participating or watching this board for years. And yeah, almost read every hard issue that's been out there has been discussed in, I think, an intelligent manner, and so anyway, I would love to get us to a point where if anyone else has other goals or anything else they want to say now, I mean, we should probably wrap this conversation up within the next couple of minutes. But if you have something, put it in and let's hone in on our couple goals next agenda item and agree to that. And if we agree, then that's the framework we should be using for thinking about how we create tactics now to accomplish the things we're trying to do.
I want to go back just a little bit. I love everything you said, but I wanted to, JD said a couple things that I wanted to comment on. First, I agree that one of our big goals should be treating this like a regularly prescribed medication. If you don't have to jump through that hoop to get it as a prescribed medication, we should not be forcing that here in Utah. That getting a prescription is hard enough, going to the pharmacy is hard enough. And I think that we can mirror that and still not have risk with especially products like cannabis. So I think focusing there and trying to carve out the things that are causing unnecessary burdens, I think will be helpful for patients. What I want to know is, can you guys specifically, because it's always access and cost and access, I should say, cost. Can you guys identify things that could be removed and still have the same safety, whatever, right? Is there things that we could take away that ag could do differently, or that, I guess not help, but that could be done differently in the program that would be able to allow you guys to reduce the cost without just driving down quality? Because I don't want to ever compromise quality just because then we can have product on the shelf. We're offering higher THC products, but we're not really caring about the other terpenes. I want this to be maintained as a good quality medicinal cannabis program, but is there things that you guys can see that we could change in the program that would help reduce cost?
I can tell you what would affect Zion, and I'm sure JD can tell you what would affect Wholesome. Probably JD and I should, since we're here representing industry, we should probably reach out to people in industry and get a consensus about if there's anything useful that all of us could agree on that would do it, because my position here on this board, I don't want to be a Zion rep, I want to be an industry rep on this particular issue, and so only knowing what my inputs are, it would be really helpful to have sort of a universal conversation. And I think JD and I together could probably hit everybody and then come back with a list.
I would love that because cost is the problem. And I can assume that at least out of that 55% of patients that aren't shopping inside of Utah, but they have a card, they want it because they expect that there will be THC in their system. It's probably not just something fun to show their friends. And so, I assume they are using, but not our products. So we will never compete with just the black market. I don't think that's possible, but if we can prove that we have a good quality product, can we switch them over? But I do not want to risk quality. So I don't know that there's something you guys can do in your own practice, but.
The point of a medical market is not just to sling THC anyway. Look, the reality is THC may be the valuable cannabinoid that gives the relief for the particular individual who needs it. I'm not disputing that in the slightest, but the whole point of the medical market is to be able to create products that will help, specific physiological conditions to get somebody into a better health state than maybe being perpetually on gabapentin, for example, or something along those lines. And so I think we're in agreement there, but knowing that that's the nature, we can't compete with the black market anyway, because how you produce a specific medication for a specific thing is not the same process of, look, well, it's dirt weed, throw it in my bathtub, throw some hexane in that thing, right? And then, yeah, will you get high? Yeah, absolutely you will. I promise you'll get high. But that's not necessarily the thing that's gonna be good for your liver or anything else, right? So.
Don't try that at home. Yeah.
I always love looking at Brandon when I say stuff like that. Because he knows exactly what I'm talking about, and then you.
Well, I know that there are people actually out there doing.
Yeah, yeah, that's right.
Seriously?
Oh, yeah.
Oh, yeah.
You should see some of the setups. It's ridiculous and not safe at all.
We're gonna
And
need
these
to
are
take care of
products being
that.
sold in facilities of states.
Yeah, that's right. So that's not our program, and I don't want that ever to be our
That to
program.
not
That kind
happen.
of education is.
Yeah, that education.
That's just an image, just the image I have in my head is pretty well convinced me.
From that in general, 100%.
But I think people get desperate and they don't know that.
They don't know the choices that they're making because they're uneducated.
Desiree, do we have time for 1 minute story time?
I don't know how to do that with Robert's rules, but I'll say yes.
So I was very new to the industry on the hemp side, and I got invited to go see a new extraction technique. And I don't know if y'all know how they extract cocaine, but it was very similar to what that looks like. There was a giant hole in the middle of this farm, and they had take plastic lining everywhere, and they were just chopping the hemp down, throwing it into this self-made swimming pool. And then they had a hexane truck. And they literally just filled this thing up with that. They're smoking by it and all kinds of stuff, watching this thing. They're like, when this all evaporates, all your CBD will be all crystallized on the outside of this plant. You just dust it off and you're good to go. I'm like, this is crazy town, right? And so this is what we see in the market, right? This is why regulated markets are different. And even from a rec regulated market, it's different. But when you go to a medical market, it's even different beyond that. And if Schedule 3 happens, it's going to even be different than that. And so, anyway, it's important from an education standpoint of why we do what we do in this medical setting versus what you encounter out in the world.
Right. I know you like to go Brandon's face and do that, but Shannon's face was amazing. You were on the wrong side of the table for that.
I asked one question related to price.
Yeah,
The $3 fee, is that per transaction?
yes.
Yes.
And I don't know if it was addressed in the SB 121. but maybe to assist with that as like a very specific goal. If a fee like, because if someone's using that $150 and that's the only money that they're using as a part of that voucher program, $3 is 2%. And if you have to make smaller transactions, whatever, it just feels like it kind of wastes the
That is
money
the-
that you're allowing people to have.
That's the biggest concern I hear from patients, that they have to go in every couple of days because that's the amount that they can afford to
Right.
purchase. And
And
so
so
they
then-
are getting dinged the hardest with that fee every week.
Yeah.
If there's a way to, I don't know,
And it'll have a
remove
cap.
that transaction fee
waive
for the people that
For
are being.
voucher patients or something.
It's a good suggestion.
Yeah.
Thank you.
I explained it to somebody in my family that I think would very much take, or try to become a participant in that. And I'm just thinking they said that the 150 would be very helpful, and I'm just thinking that in this same setting, if that $3 can add up pretty quick and take away what the
Exactly.
purpose of the voucher
Yeah.
is.
All right, Desiree, that's everything I have on the goal setting.
Okay, well, I liked it, and it will make our next meeting's agenda item.
Can we put together either some sort of Google Doc or some other Excel doc that we can dump these goals into and be able to provide feedback before next month's meeting? Like,
Yes,
learn how to
please.
get access to Gmail.
It's fair, it's fair. I'm good at a lot of
And
things.
we should
but-
probably, yeah, no worries.
Could we just
We
make
should
a second
probably-
tab
We should
on
probably, yeah,
agenda items, and it will just be like goals?
and I think we should come back around.
On our tracking.
Yeah.
Yeah, oh, sure.
Agenda
Yeah, we can do
item.
that.
Then everybody already has access.
Yeah, and then just bump that back to the top of everybody's email boxes.
Yeah.
And then we should also probably swing back around on mission and vision, since I think it
Yeah.
sort of goes
Yeah.
part and parcel with that. And I know that we kind of had like, some ideas. I mean, things were written out. We should probably come back and make a decision on those next month, because I think those will inform goals kind of going forward too.
Agreed.
When I wasn't being facetious when I said there should be an organizational chart, under the new changes that have happened in terms of the program as a whole. And I think as part of that, it would also be helpful to have key points of contact, and if available, a timeline for meeting dates, so we can know, or at least have an idea of when we need to get communications from one party to another.
Well, and we might be able to even set up contacts months in advance, like just plan our
Sure.
meetings, quarterly meetings, make sure they're all planned.
Sure.
And then we know what we need to be prepared for and what we have to have discussed.
Yeah.
I think working group would be 100% fine with that. And would probably, I know they would, so I think the licensing people would. But I'm gonna write that down. Okay.
Hexane seems awful. As I looked it up and like, oh my gosh.
You can have a lot on a farm.
Well, you can also make glue out of it, so.
So ruminate on that for just a minute, and then we'll kind of maybe pin it down a little bit better on agenda item number 8, but agenda item number 7 is something I have been excited about for years. I've even been pulled over a couple times and I was like, look, well, you have me here. Could we try to look at the UCGIS side of things? And they're like, no. So,
Way out of the table.
yeah. I'm like, anyway, while I was speeding, now that I have you here, but yeah, they don't, they have, one of them, you know what, I'm not gonna say how many did what, because that just gives you an idea of my driving. So it would be fair to say that some were still unaware that there was this possibility. And so, this was one of the biggest concerns when we were doing the compromise, right? We had the only way we were gonna get this passed was if law enforcement had some way to prove that this product that, I get pulled over, not that it ever happens, but if I did, if I had cannabis on me, what that how can they prove that that is from the state of Utah and it's not from another state, or it's, not black market products stuck in a new jar, there was so many concerns. And so they wanted to offer lawmakers a way, police officers a way to see if this product was from the state. But then that comes to feels a little like a HIPAA violation, right? Like, what do they have access otherwise? Are they gonna be able to look this up and just see that their neighbor is using cannabis? Are they going to be able to look up and see everything you've purchased, your condition you're using it for? There was so many concerns from the public and so many concerns from lawmakers and law enforcement just trying to come together on this. And so, and then we thought we had it worked out, and then law enforcement officers were terrified to use it for like 2 years. Nobody had ever accessed it. They didn't want to. We realized that we had set the charge, if they looked at it at the wrong time, high enough that no one was ever going to risk it. They were just going to give you a ticket and then let the court sort it out. And that was when we called them, that was our quote. So this has been a long time coming, and he's probably got a call and he has to leave, and we now have to wait another year about.
Nope.
I'm really excited because we're gonna possibly see for the first time exactly what this looks like for law enforcement officers. When they pull somebody over, so.
Christmas for dead.
Yeah, Christmas for dead.
Okay, so as she mentioned, this is gonna be kind of focusing on USEGIS, which is the Utah Criminal Justice Information System. If not trying to make it sound scary, if you think we can find information about you, that's where it is. It has everything from Utah, but there are also capabilities to look through the entire country, including people, vehicles, warrants, anything. So that's where we have the access to be able to look up a medical marijuana card. Whether really all we can see is whether it's active or not. Even if it's not, it will tell us when it ended and kind of a reason why. If you go to the next slide, I just put screenshots of what we typically see. This is just what USEGIS looks like in general when you first log on. You can see in my favorites, it just lists a lot of the things that we use most commonly. You can go to the next one.
I'm gonna look at your screen because I can't see that.
You're good. So this next one is if I were to run someone, I wanted to show you guys what it looks like. Our state expectations when I'm running criminal history for the state of Utah, criminal history for the country, and the medical cannabis cards, and then what the expectations are if I were to write a warrant for DOPL, the Department of Licensing. Just to kind of have an idea that JD bringing some points up about in the future, if it's treated like a Schedule 3 controlled substance in the future, would we get rid of law enforcement's ability to look at the way we do now with cards, or would we need a warrant the same as every other controlled substance that somebody would be on? Because we do have access to see that through DOPL, but we have to use a warrant, not just a transaction in USEGIS. If you move to the next one, you can see a little bit at the bottom. You can see the audit purpose, the requester, and the audit reason. So the audit purpose, that when you're looking up someone's criminal history, is very typically just going to be criminal justice, meaning that it's part of an investigation. Sometimes we might use it for domestic violence, just verifying if somebody has a prior conviction. The requester, for me, it's always going to default to A Griffiths, and then the audit reason needs to be a case number. So whenever if I'm doing something, I'm running somebody's criminal history, if it's to see if they have priors or anything, whatever I'm doing, that's going to make it very clear in my USEGIS transaction history as to why I did that. You'll see when we get to the medical cannabis one, that is not there. It's still, you put your name in it, it's still going to be in your transactions. What I could verify, our transactions are saved for 90 days. So if somebody makes a complaint, I'm going to be honest, it's probably hard to. Whatever the complaint could be in the future. That transaction history may be gone and it may be hard to verify. Why law enforcement stopped, whatever the case may be, especially if there was not a case. If you go to the next one, actually, sorry. On that, you can also see when we're running in-state criminal history, it can be by the state ID, name, social security number, driver's license number, FBI number, or some other info. If you go to the next one.
Can I ask just a quick question?
Yeah.
So if you don't have that case, if you don't have a case number, you couldn't move on to see if a medical cannabis card is being held?
We can't.
You can.
We can't currently.
So making sure.
But not with Utah criminal history or countrywide criminal history. So you'll see this one has the same thing, the audit purpose, the requester, and then the audit reason, and then you get into the FBI number or the name. So that one, again, both of those, if I'm running criminal history for anything, whether the state or the country, I do have to have an auditing reason, which is just going to be the case number. If you move to the next one, you'll see this is kind of what opens up for the national criminal history search. Don't let it fool you. The red dot there for last name, you have to fill all of that in or it will not let you. So you have to have the full first and last name and at least date of birth and gender. If you move to the next one, this is to show you where we get to the medical marijuana transaction. Besides typing in just the transaction code, which is the MMJL. So you have to go under, you're obviously looking at a person, you're looking for local, and you're looking at the law enforcement transaction. It's honestly just kind of a catch-all because that's where they put the probable cause, which is what, if we're booking somebody into jail, we would fill that in. But that's where you would fill it out, or in the very top where it says transaction code, you would just type in MMJL and it'll take you to the next slide, which is what it looks like when we do a transaction on somebody's card status. So again, it's going to have A. Griffiths for the requester, but it doesn't ask for a reason and it doesn't ask for an audit for a case number. So all I can say is that I think for something like this, where it is that third degree felony, if we're doing it inappropriately, we should probably be treating it the same way that a class B, which if I had a violation of running things that I shouldn't, on the first two, it'd be a class B. For this one, if I did it on purpose, it would be a third degree felony. If I did it on accident, it would be a class C, I think.
And you would lose your job at that point.
Yeah, if you do any of this, you would very likely lose your job and you would then be investigated by post, which is in charge of your licensing as a police officer. What I have seen most of the time, depending on how many times you've done it or the severity of whatever you were looking up, it can be anywhere from a suspension of your license to a complete revocation and you cannot work as a law enforcement officer.
And those penalties haven't changed, right? They are still.
Those are the same,
Yeah,
but I want to get clear before we move on. So you don't have to have a case number.
but if you read the law, if you present them with a medical cannabis card, they do not have a right to run it. If you read this in the law, if a law enforcement officer stops an individual who possesses cannabis in a medicinal dosage form, cannabis product in a medicinal dosage form, or a medical cannabis device, and the individual presents to the law enforcement officer that they hold a valid medical cannabis card, but they do not have the card in their possession at the time of the stop by the law enforcement officer, the law enforcement officer shall attempt to access the state EVS to determine whether the individual holds a valid medical cannabis card. So there is gatekeeping on when they can actually even access the system.
Yep.
So to me, if you present them with what otherwise looks like a valid medical cannabis card, and they don't have reason to suspect that it's been, you've faked it, or that it's not real, or that, and even if the product that you present them with, right? You know what I mean? Like, so I think that's the thing that, to me, why the penalties, warrant it, right? Because there's a gatekeeping function where it says you're only allowed to do this in very certain circumstances. If I present you with a valid medical cannabis card, you don't get to then go run the system. And I guess my question would be, in practice, like, there's nothing that prevents them from It would just be my word against theirs in court, right? Of, hey, I presented them with a valid medical cannabis card. And unless I was either recording the interaction or they had their body cam turned on, it's my word against an officer, and you know how that's gonna go in a court of law generally. So I think the penalties probably warrant it, because look, at this point, wouldn't it, I mean, it's almost. I get you could maybe fat finger something and access something you weren't supposed to, I get that
Yeah.
happens. But to me, this would, I mean, almost suggest that it would be done, intentionally, right?
Yeah.
To just.
So that's why I think the class C to me seems a little strange, that it's lower than what a regular BCI violation would be. I mean, that's the same as not having insurance in your car.
And that's what the law currently is.
But I believe it was higher in the beginning. And
Cause I know when Jimmy was on the board, Jimmy,
yeah,
can't remember if we ever made a recommendation on that or not. I can't remember if that ever made it into a bill or not. Probably need to verify that, but I just wanted to be clear, like, I want to be clear more on like what happens in practice. Like, does this system, there's nothing about the system that would prevent them from just running it, right?
No,
No different than.
no, and that's why I think
Than
there
them
should be.
accessing other information they're not supposed to, right? So basically, it's on the individual officer.
this all like the game unit when we went to that conference. It's good. And we, part of the reason why we were there is because they had stated that nobody was willing to get into UC just because the penalties were too high. And also we had language in the beginning, remember, where it was an encounter, because I worked with Jimmy on the word encounter. And we were like, what does that mean? And they were like, the language is wrong, we need to change it so they kind of have like a case number to get in. So this is sounding inconsistent to what we thought we had changed to me.
It looks like SB 233 in 2024 got rid of the third-degree felony charge for knowingly and intentionally releasing information from the EVS, and replaced that with a law enforcement officer who uses the database used by law enforcement to access information in the EVS system for a reason that is not the administration of criminal justice, which there's a definition of that, is guilty of a Class B misdemeanor.
So it's brought back down.
And that was what, Bill?
SB 233 during the 2024 session.
So that'll come up in the next thing, because then there's, you can see that little link that says click here to see more information to use this transaction. That's where I got that PDF that I sent you today that says it's still a third-degree felony in the Class C misdemeanor. So that should probably be updated so that law enforcement like me, when we click on that and you see third-degree felony, I mean, in my opinion, I don't really have a problem with third-degree felony, because I think this is that strange middle ground of it is a UCJS transaction and it's still being classified as a Schedule I drug in some settings.
Yeah.
But I think it's a good middle ground. Basically, I don't need to write a warrant for it, because it's typically going to be during your investigation, a very quick interaction. At the same time, if there's more information that you need, then you can easily write a warrant and take it to whoever you're trying to get more information from, whether it's the state or private business. Like I said, my biggest thing pointing out here is that if I were to make any kind of a suggestion, especially for kind of what JD was bringing up, I think that not only there should be a case number and it should look the same as the previous two that we saw. I think these transactions should be saved by BCI and UCJS longer than other transactions, because if a complaint comes up, if it's gone in 90 days, it's just gone. And then you won't know if these conversations need to be brought up with Post. Even Post couldn't look it up to see whether we were doing something correct or incorrect. And I can agree that I think even now, and I don't, even with it being a Class B, a lot of people have still felt very hesitant to use the transaction. I think I've used it 3 or 4 times. I can think of the last time I did it, and it was just that the guy he had marijuana in his possession, not even informed that it likely should have been. But then he didn't have his card with him. Because
to me, it seems like you have to verify 2 things, right? If you stop them and you have to determine whether the cannabis or the device they have is in a medicinal dosage form or is a medical device,
Mhm.
right? So that's number one. And then if they represent to you like, when you're like, oh, hey, are you a patient? Because that's gonna be the next question that follows after you find that. Then they're gonna say yes. And then your next question is, okay, can I see your medical cannabis card? Then and only then, if they can't provide that to you, is when you're supposed to be able to access the system. So I think it's interesting that people are hesitant to access the system, especially when you only have a very limited set of circumstances under which you can do it. I can understand the potential for a criminal penalty, but then in practice, what is happening? Like, so if I present you with, my product has all the labels on it, it's in the opaque bag or box, I'm supposed to have it in while I'm in public, it's in the back of my car, so you can't argue that it's a Dewey, right? All the things I'm doing, all the things I'm supposed to, I present you with my valid medical cannabis card. And I understand there's a fear to access the system, but then what happens in reality? Are most officers just then citing people and letting the courts figure it out? Is that still the way it's going?
I would
Or are
say-
most officers following and saying, hey, your product looks good, card looks good, go on your way?
I would say there's good news and bad news. The good news is I don't see it happening very often where people are carrying correctly and getting stopped by law enforcement to begin with, which means that if you're carrying it correctly, the way that the state says, you're probably just not going to interact with this in general. The other times, every time that I've done it, the card's not present and the items with them are not being carried clearly from a dispensary. It's almost no, all of mine have been just floral in their own bag. And
So what happens if someone presents what looks to be otherwise valid products, but they don't have their card on them and your officers are unwilling to access the system? What does that result in?
as a supervisor, I would tell them they need to access the system.
Of course,
but
but are you aware of any circumstances in which they just say, hey, we'll let the courts figure it out?
I have not found any, but it shouldn't be happening. It should be, and I think that's the same thing as the education is. They don't have their card, just go run it.
Because I feel like that, you and I have talked about this before, I feel like there's an opportunity for education amongst the law enforcement community to help them understand, hey, this is the circumstances under which you can even run this. And what I would hate to have happen is them, I get it, you're fearful of your own potential consequences, but to not run, like someone's, hey, I got the valid products, I just forgot my card at home or wherever, or hey, maybe I left it at the pharmacy. We have patients that leave those types of things at the pharmacy all the time. I'd hate for them to err on the side of, well, you can go tell it to the judge. So I think there's an opportunity for education here.
One question I would have too is that changing the verbiage or adding literally one word, which is shall, that we shall run, because
Not that you just may.
I'm not
have
saying
a-
cops are not intelligent, but when it comes to things like domestics where it's a shall arrest, or if you shall verify, it makes people get educated and then they do what we should have been doing the whole time, but it's more effective typically.
Yeah. And then the system itself, obviously, the patient's not gonna have their card number. Is it just like,
You can run it by name.
okay, so it'll pull it by name?
Yeah.
Okay.
Yep, so you can do first and last name, date of birth. It doesn't show any of those as asterisks. The few times that I've done it, I haven't ran into like, oh, well, there's like 15 versions of this. I've been able to find clearly who it
There's
is.
some sort of identifying information. they
Yeah.
Provide you, because I think they can use your driver's license or identification to run it, right?
Yeah.
Okay.
Move to the next one. So again, I wanted to compare, we recently had a case, in Sandy where I work for, that would be very applicable to this. It was pharmacy fraud. Basically, he was stealing from, his employer. And so if we're trying to verify any other controlled substance being legally obtained by a person, we have to write a warrant for it in order to send the warrant to Doppel and say, does this person actually have a prescription for whatever? So I think that's kind of like I was saying, a future conversation of if things change, are we going to treat it more like you were saying, treat it like everything else? Because for everything else, I've got to have a warrant to ask if this person has a prescription or not. This just shows the different transactions for that.
Can I ask you a question?
Yeah.
So at least in a lot of the law enforcement officers we talk to, usually when somebody's getting pulled over or something, they're pulling them over for some other reason, and then if they happen to notice something else is when they start to think about it.
Yeah.
I have not encountered almost any circumstance, I'm not saying it doesn't happen, but I've encountered very few circumstances where anyone has told me, I pulled them over because of suspected marijuana. Like, I just don't hear that anymore. And I also, so we do a bunch of education with the local police departments around us. And they all are now looking for things like if it's got a processor label, a pharmacy label, they just don't even, they don't even really like think about it in a large case. When they see a nerd rope, even if they present a card, they're like, we know that's not a valid form. Therefore, we're gonna go ahead and run, right? And so, yeah, I guess like, how many times are people getting pulled over for marijuana versus, oh, let me rephrase this. If an officer pulls somebody else over and they see a pill bottle for Oxycontin sitting next to them, do they go ahead and start running and DOPL and request a warrant to start looking at it in that case?
I would say very typically no, because it has the name on it. And so again, it's just. That one's easier for us because it's just, well, there's this prescription, but it doesn't have your name on it, doesn't have your name, the name of anybody in the vehicle. So that one, we can just jump straight to possession of controlled substance.
It's
All
down,
cannabis products have the same information on them.
Yeah.
And I think that's something else that should be.
it sounds like the way to, if you want to treat it like all other drugs, then when they get it out, it should just have their name on it,
Yeah. Yeah.
right?
I mean, look,
Yeah,
again,
but
it's the whole
that's
problem that you have to carry
It's
a
a
card
big
around
thing.
to have this medicine, right? Like, I think I
You
go
can
back.
have the
to the-
original
go back to-
package with you.
Well, no, you still
You still
carry the
need to.
package, you not the receipt. Yeah, not the receipt. and
You never
can
need
have
the receipt.
Personal use.
Law enforcement was just claiming.
Oh.
But like, if
That was
we're
in
able to
there.
produce the box that had your name on it, right?
Yeah.
And then, right, I'm not suggesting anything, it's just like, I just keep hearing the arguments over, like, if we're gonna treat things equally, I'm always curious, well, how do we treat Oxycontin?
Mhm.
Like, what do you do when you encounter a bottle of Oxycontin in the car, or whatever?
And to answer your question earlier, no, it's the times that I've come across where I have taken the substance and given them a citation. I've never taken anybody to jail for it, just a citation. It was for a traffic stop of whatever other reason, and then we come across it, and whether it's unfortunately the person telling me,
Right,
hey, I've got this in the car, but I have a medical cannabis card, but I don't have it with me, and then. I'll go
but then you
run
have a case number anyway, because you
Because you
stopped
do a
them for
traffic
this,
stop.
and now it's part of the investigation.
That's
right?
why I think it should be treated the same as the other
Yeah.
transactions,
Yep.
because you should not be doing that unless you're doing some police interaction, which is gonna be, you should be called out on with some documentation of it.
Cause you at least have to have reasonable suspicion to have like a non-consensual, encounter, right?
Yeah.
You know what I mean, with law enforcement, right? So, that to me, I think.
They have to
again,
be detained
I think
to some extent.
hopefully what's just not happening is because they're concerned about what their own criminal penalties might be. They are letting a judge figure it out. It doesn't sound like that's what's happening
No, like I
in
said, it's,
practice. But I think I think it's gonna be, to me, I think a lot of it is just gonna need to be education of like, hey, here's what legal products look like. They have very certain labels on them. We can show you, literally, Utah market's not that big. We could show you every single packaging for every single brand and what they look like. I mean, that was my presentation at that gang conference, is like, this is what a legal product looks like here in Utah. This is what a non-legal product looks like, right? I mean, pretty easy to discern between the packaging. Now, of course, there's a lot of, product that's been diverted out of legal markets where the packaging does look that way, but Utah products have to have very specific labeling from the processor as well as a pharmacy label. So I think that is the first thing, like, hey, if the product looks right, then the only way you get to that final step of being able to verify if there's a patient is if they don't present a card, or not. So I think as long as that is being followed, then that's the best you can hope for. But it sounds like officers are stopping short because they're concerned about what the criminal penalty. That's fine. At that point, you can't verify it. You're either gonna have to make an arrest or let them go. They should probably err on the side of letting them go if they don't want to do their job, even if that means there's consequences. Hell, I gotta do things all day long for my job that might cause consequences for me, and I'd rather not do them, right? But It's called being an adult.
Mhm.
So I would like to see, I'd like to make sure that that's happening. And if it is, if you think it would be advantageous for us as a group, or any one of us to help develop some education to, I don't know if it's at the post level or if at the local level, because at this point, this has been in the law for long enough that I would hate to see it being, to see it being abused. And again, just another potential reason for people to not get a card and engage in more sneaky, behavior. And I'd rather you guys be spending your time trying to uncover that than being like, oh man, I don't feel comfortable running that, running their identity. I'll just, we'll just let, the judge figure it out, and we've talked about too many people having product confiscated. I think that's, kind of gone, kind of died out. But it just seems kind of odd that it's, your duty is to the public, not to yourself necessarily. And it seems like more people than not are, or some are saying, well, I'm just not gonna run it. Hopefully those encounters just end and say like, yeah, go on your way. Everything looks, you don't have your card, make sure you have it on
And
you next time.
that's what I'm hoping. I was out of the times that I have stopped somebody and unfortunately then it turns into investigation. Every time it's come up, I'm like, please, because I want to have this story where I can just say, I can let someone keep their product and move on. Because I'm still going to have it. What should be happening is I still should be doing a case because I did legally detain the person. And if they've got their card on them or they don't have their card on them and I look them up in UCGIS, their product looks good. That's what I want. At the same time, I think doing some of the follow up on these transactions, how many times they're being used, what the outcome of those transactions are, how many times are they being released with valid product, how many times you will only help future changes to show, hey, the people that are participating, 80, 90, whatever the percentage is, that they are being in contact with law enforcement, they are carrying correctly, only helps the benefit to show like, hey, people are predominantly listening to what they're supposed to do. If you go to the next one, again, sorry. This is the list of all the warrants that we can write. Again, the Doppel search warrant is the one where we would verify any controlled substance prescriptions. If you move to the next one, an officer would utilize the Doppel warrant template if the case was involved in doctor shopping. I would say that's when you're looking into more of like the narcotics or the gangs unit. And that's typically where you see that. So again, if we're doing search warrants for prescriptions, it's very rare that I've seen it just on the road. It's when you're getting further and further into an investigation where, again, that the guy brought up was stealing from his employer using personal. That's a lot bigger than just your typical law enforcement. So I think it balances out currently. I just think that there needs to be the documentation of the case number. But in the future, if things change, should we be writing warrants for it and not just using a basic transaction? When you get into the warrant, I can't show you the whole process if you go to the next slide. But this is what you start looking into. It's going to ask you what type of warrant, what jurisdiction. So the third, which is Salt Lake County, what county, your case number. So again, all these other things are asking for a case number for more reasons, more explanations. And like I just said, I don't have any reason to believe that people are misusing the cannabis transaction, but it's not being documented the same way that all the other ones are. The next one, if you go to it, just if anybody has general questions.
I mean, the last thing I would just say is, I think your point is well taken. When I write standard operating procedures, like I want to have it all be the same, right? Like my management SOP is the same for all my facilities, et cetera, et cetera. Having just a different process doesn't protect you. I always joke with Brandon and Cody, I like a warm blanket of rules.
Yeah.
Right? When you have a different type of a process, you're entering into riskier territory. Your blanket has holes in it.
Yeah.
So.
Yeah, and I mean, there's other transactions such as facial recognition. First, it has to be a felony. You have to have your case number. You have to type in a little probable cause statement. Like there's all these other things that have easier ways to document what we're doing, why we're doing it, but medical marijuana one does not. So that's what sticks out to me. the most, and then I think. Education, but also maybe putting in one word that says that they shall run it. Because that puts the burden on us to be doing what we're supposed to be doing and clear violations if whether we're doing it outside of when we're supposed to be doing it or if we're not doing it and verifying whether we should be verifying it on the road so they don't have to go to court.
Yeah,
And
absolutely.
through a process that they would then have to pay more money for, and then there's, yeah, even if they come out on top. It's the inconvenience of taking product away from people that shouldn't have taken it.
Well, once they're headed to court, they can't come out on top. Like, coming out on top is past.
Especially if that transaction. History is just gone.
Yeah.
So a recommendation from this board that there be a case number and there be consistency with other medications. And possibly a longer period in which the documentation is maintained.
The transaction history for
Correct,
MMJL is
Yeah.
held. I would say something like 6 months.
that would be useful as a recommendation from this board.
We can take action on that today if we want to come up with a well worded recommendation. I mean, if we want-
add audit purpose and audit reason to the MMJL transaction
Getting this, Trevor, because you write fast for me.
Do my best.
to mimic, and my computer's dying, to mimic the transaction for Utah criminal history.
And then,
So the purpose of this recommendation is to make marijuana searching to search the database for marijuana the same as other drugs.
Yep.
That's the purpose, right?
Not other drugs, just other
Other
investigations.
investigations.
Yes.
Because we're gonna make the recommendation, eventually it's gonna have to change the law or anything else. We should be able to tell them, this is the purpose of why we're doing this. This is different from this. We should all just be uniform.
Would that word shall fit in that code that you're looking at? If it was added or if one word was changed?
I like the word shall, I would like it to be extended 6 months that you can see who's on there.
Are there other things where shall's not used?
Pretty much. I mean, shall is not used very often outside of domestic arrests.
So in order to keep it consistent, I don't know that I would add shall. I mean, I understand why you're saying that we should, but
Mhm.
like. We're going for consistency, then we're still now making marijuana slightly different, right? By using it in the same format that we would for domestic abuse, which that wouldn't be the
Yeah.
intention.
The only reason I say shall for that, if
It
it
says,
fits.
it actually says shall.
Okay.
It says the law enforcement officer shall attempt to access the state electronic verification system to determine whether the individual holds a valid medical cannabis card.
Okay.
Then that's
Sounds
good
good.
because,
Check.
yeah,
Check.
Good. I don't want to change it to match
Because-
everything else. Let's leave it. I don't
so
want to
that's
add it.
just
if it
saying,
doesn't-
if they don't have their card. And
So
they
if they
say that
possess
they
it,
do have their
if they
card.
possess it in a legal form.
Yep.
And they do not have their card, but they state that they're a valid medical cannabis patient, they can access the system. They must ask.
They shall
Shall,
access the system.
attempt to access the system to determine whether they hold a valid card. And then if they hold a valid card, they are not allowed to arrest them and they may not seize the cannabis, the product or the device.
Can you? What is the number on that code?
26B -4 -216 4. And then this recommendation would be more of a practical recommendation to I mean, I guess they would have to update it somewhere in the law to just say that with respect to this, you know, their attempt to access the system, it has to otherwise be similar to how they would access other relevant criminal history.
Yeah.
Would they have to follow the same procedures in order to do so?
History or medications, like.
Criminal history, history. Does it say anything about the driver's license in that one? Being
I
present?
don't think how it says how that they can use in order to do it. I think that is that somewhere else, but I don't know. It's not in this one. I don't know if it's somewhere else where it talks about uh, how they go about it. I'd have to search that.
And I guess the other recommendation would have UC just update their PDF. So that it doesn't say third degree felony and class C misdemeanor.
I found that presentation from about 2 years ago.
Okay.
So that's UC just as standard presentation, so.
They just need to update that to that link in the transaction.
And what were so it doesn't say, what did you say, class C misdemeanor?
It says third degree felony and class C. It should just, from what we heard earlier, it should just be class B.
It's just a class B.
I like when other people find like little errors and fix them. It's very satisfying for me. Yes, we just have to update the form. That's.
Shell's already in there.
Shell's there, that is great, yes, excellent. It's the little things, Misty.
I've been waiting since medical cannabis was allowed. I've been waiting to have an interaction where I give the person, or not give the person their stuff back, but I don't take it. Because I was just looking for, I don't know. Just say, like, yeah, I let them keep their
Yeah.
marijuana. or their cannabis.
Have a good time, sir. Not that. Have a
No,
nice
not
day.
that, that's right, no.
I don't know, obviously I can't.
Hope you get the relief that this podcast
Yeah.
is designed to
That's
provide for you.
That's exactly what it's like.
A nice way of saying have a nice day, and then when I said it, I was like, that sounds more like something you'd say at a party. So I changed it. Do you want to make a motion, since you seem to know the words, because I was.
Yes, I look at the way you wrote it down, so I can,
would
It's a little,
as long as I
let
can
me actually
see.
type it out so I can be quicker.
And we can wait a little bit.
Do you want me to make a motion for the history too, for keeping the?
I actually think we should have somebody else motion, just because you're not against your own, obviously. And so I would not that want to be held against you in some way, shape or form. You're just providing information.
If you guys want to use that.
Information has been provided.
Information has been provided. Oh, and that information was very helpful. I think we should make a motion on that information you've just provided that will be better for our patients.
Yes.
Yeah.
Cause I think keeping those records of that transaction,
The records is crazy to me just because for the FDA perspective,
Yeah.
we have to retain records forever on
Years.
everything,
Years.
years.
and
In
if
fact, I have SOPs from companies that no longer exist because it says you will keep them in perpetuity. In case of drug we ever
Well,
made,
and a controlled substance license law is what, 7 years?
7 years.
7 years. It's how long we've been, for research,
In perpetuity.
right?
They'll die when I'm dead, because then I just won't care. But
I probably sound crazy saying this, JD, but I actually don't have a problem with it being a third degree felony, or at least a class A, because it's.
When I was looking at that part of the law, and it does talk about like, if someone were to access it negligently, I think it's a class C misdemeanor, and then if someone were to like access it by like fraud or whatever, that's when it becomes a felony. So I mean, it is one step up
Did we
from
say-
what someone else would experience if they were to access it. But again, to me, I think the penalty should be significant, but I also wonder if that penalty just then prompts more in law enforcement not to check it and then go the other route. So like, as much as I'd like to see accountability, I also don't want to see that land on the shoulders of patients, because law enforcement doesn't want to check the, check the system, but it sounds like they're supposed to, by law, now, so if you don't, I don't know. It might
Purpose
want
terms, what did you say?
more harsh penalty.
Purpose is to align with other, align the medical, like, what would you call it, the medical cannabis? The MMJL?
Yeah, so
is that-
align the MMJL transaction. With
With
other
other-
usages. Criminal investigations.
Okay, and then we would say that we're going to keep a 6-month history, move it, yeah,
Retain MMJL transaction histories for, what was it? 6 months.
okay, and then. Yeah, so that one's that, and then. And then do we need to add that one too? Add the audit purpose?
And reason to MMJL transaction.
Reason and audit purpose?
Yes. So it just looks like, it looks exactly the same.
Also, if we don't feel like, or we need a little time to wordsmith it, it's okay to have this on the next agenda as well. Versus, because I don't want to rush, always measure twice, cut once.
Right, and I'm gonna read these back and you guys can tell me if that sounds like what we discussed. If it does not, then we'll just postpone and do it next time. If it sounds like we've kind of nailed down the language, then we'll do it right now.
Okay.
Okay, so what we're talking about doing would be, to change, to adjust the purpose to align the MMJL transaction with other usages, criminal investigation. Then we would ask to maintain the MMJL transaction history for 6 months. Add audit reasons and audit purpose in MMJL to mimic transactions for the Utah criminal history, to mimic transactions. Yeah, is that right? Word right? And then, the usages, and then add that we update the usages presentation PDF. So if you guys think that sounds like it, then I would like to make a motion that we move to align the MMJL transaction with other usages criminal investigations that we.
That's right, I'm gonna.
Yeah.
We're not voting to align it, we're recommending.
Okay, sorry. Do I need to restate it, or are you just gonna type it?
The record, I think it's better.
Okay, so we're going to recommend to align the MMJL transaction with other usages criminal investigations. We recommend to maintain the MMJL transaction history for 6 months. To add the audit reason and the audit purpose in to MMJL to mimic the transactions for Utah criminal history. And to recommend that UCGIS update their PDF presentation.
Chair at second.
And then can we do a
Ask if there's discussion.
Yeah.
No discussion, then proceed forward.
like we discussed, is there any discussion to the motion?
Do we need to indicate what we need to update? What change
On the
needs to be
PDF?
updated on the PDF, because right now we're just leaving it
Update.
open.
I thought about saying that, but I thought maybe they could just update it with everything that's on here.
Okay.
I mean, I think you could say update it consistent with the recommendations in the motion.
Consistent with the recommendation, yeah.
Yeah,
Thank you.
But
yeah, recommendations made and Utah state code.
Yeah.
Please say I don't have to re-say all of that
You can just say it with the
Yeah.
addition, yeah.
with the last one, that we recommend a sorry, what was that one? What are we doing here? Oh, I put it on the wrong, sorry, I put it on the wrong one. I'm like, this isn't making any sense. Okay, yeah, we recommend to update the PDF presentation in UC just, with the recommendations in the Utah State Code.
No, consistent with the
Sorry, I'm
recommendations
looking-
in this motion and in line with the Utah State Code.
Okay. Then
Any other discussion?
any other discussion? Okay, then we can.
That's right.
Yeah.
I mean, here's the thing, like, I
Wait.
think it has to be super, but you should follow the process. So.
Then can we go ahead with a roll call vote?
I figured that.
Okay. I've never done. Oh,
I got you. Start right here. Annette Berejny,
Yes.
JD Lordson,
Yes.
Blake Smith,
Yes.
Misty Smith,
Yes.
Cami Clark,
Yes.
Kent Anderson,
Yes.
Anthony Griffiths,
Yes.
Desiree Hennessy.
Yes.
8-0. CP vacant.
Okay, that motion passes. Okay, and I think those will be good recommendations. Thank you. I love that, all of it, and I'm so glad we went into it because we did find things that were concerns from the very beginning that have been really hard to really a good look at. And we didn't even have to get pulled over for it, so I appreciate that. As try as you might. Yeah, try as we might to have a good discussion about UCHS.
Is Post gonna have to train based on?
I think they
if these changes
should.
are Approved?
I was gonna say I don't work for Post. I was working for Post,
Right.
teaching part-time. I can reach out and let them know if they need it to be taught. I can probably do that as well, but that in my opinion, it should have, I don't know what they're teaching so far as medical cannabis in the police academy. If it's nothing, there should definitely be something. I don't know if that's something that can
But
be.
my whole point would just be, okay, so we're making this recommendation, we're gonna probably be trying to get changed through the legislative group. We should probably inform people that this is going to affect, that the cannabis board has just said that we want this aligned. You should all be aware that cannabis wants this aligned, so. You know, heads up, and if people start to fight against that, well, then at least we know who we need to go discuss with. And
Yeah.
if they're like, yeah, well, duh, that makes sense, well, then we all win, and that should be easier to get through.
If there is any pushback, it would be from FOP, the Fraternal Order of Police for the state, because that would be the rest of the law enforcement outside of this room, their mouthpiece of saying we do or do not like that. I don't see why people would argue it because it's nothing different than everything else that we do. But that's who I would anticipate
Well, I mean, by law, they're already required to do it. So the process by which they do it should match, right?
and the documentation should be the same or more, because
Anyway, it would be good to give them a heads up, so.
I can reach out to, well, I know some of them.
I can get you the state.
That would be good. Our next item. So, no, I was thinking my clock was wrong, because like that one is wrong.
Yeah.
I'm like, wait.
She was like, we're crushing this.
Like,
meeting. It's only 3:00.
Okay, our next agenda item is next meeting's agenda, and I think. We talked about. Moving forward with more goal, oriented. Decision making, some strategy, so if we wanna just.
do we wanna pull up the tracker, make sure there's nothing on there that we're feeling like needs to be addressed, and then let's maybe just talk strategically about how we can move forward with this, those items that we're talking about with our 3 wants, maybe make that other tab and we can add our 3 to 5 main goals, and we can decide kind of how the next meeting should go.
Get rid of that sign. No.
So do you have what we came up with, like our 3 to 5 goals, Blake?
We have cost for patients. We have access, and there's really kind of 2 aspects to that. One is a research access for patients and everybody else, but also access to these products. How we increase that. Third is how we maintain safety and quality and the differences of what we have here versus what we find out in the universe. 4 is increasing patient count. 5, reaffirming past decisions, and 6 is education. That's what I have.
I think JD had a good point too on creating a Google Doc that those of us can continue to think about and bring it back, maybe not necessarily as an action.
I
next
think
week,
what
but
they'll do is
discussion.
they'll just reshare this with us, and then you can just add to those. And then, let's make sure we can also share, whether it's part of this document or otherwise, that mission and vision statement. So we can take action on those as well next month.
I believe that's your document that has the
The mission and vision.
language, right?
And I can use.
Make sure everyone had access to that document so we can make the changes in real time, so we're not working off static Word copies.
Yeah, you're right, a note for me to reshare that.
So with the shift in the future, is UDAF supporting providing board person for support? So right now, Trevor, you're the guy, but like.
Trevor's
moving.
It's gonna be
Trevor's
the
moving.
guy, yeah.
If the guys like me.
Okay,
I would like to have a conversation at some point about Trevor's role in how you all see it. And
We're
to see-
not firing him.
Well, of course, so I'm not saying that. I'm just saying, for instance, there's things that Trevor was allowed to do when this board first started. And then he was no longer allowed to do those things. I would like to have a conversation with you all as to whether you see, the usefulness in what he previously did for us. And how you see that as either being representative, or is he speaking on behalf of the department, or is he really just, while he's employed by you all, he really would be speaking and doing those presentations on behalf of the board? Because quite frankly, I think that change has taken some wind out of our sails. You know what I mean? And his inability to talk to licensees and some of these other things. So at some point, I'd like to have that conversation as well. We don't necessarily have to have that publicly. Would like to follow up on that to just see how your vision is for him. So we know how, and with the transition, how we can effectively use him and use him according to how you guys, see fit too.
Yeah, I agree with that synopsis.
also, is there anything in rule or law, and I'm sorry, I'm ignorant about this, that requires health and ag to stay here for the entire time we have meetings?
So
We wouldn't
really
want
enjoy
it,
some.
right?
I tell you.
I can tell. Based on the look on Cody's face right now, I can tell.
I just know how busy I am, like, there's obviously specific reasons why they're here, especially when giving reports and everything like this, but unless we have a specific agenda item that requires them to be here to answer questions, I don't know, we need everybody to be represented the whole time. We have a 3-hour meeting.
necessarily not be long.
I don't have a problem if you guys want to stay and hang out, that's cool, but like.
No, I think that's the reason we're here, is to be part of the company, not obviously part of the board, but part of the conversation, and to.
100%, I don't have any issue with it, I guess my point would be, I feel like you guys all feel like you have to be here the whole time, and I don't know that that's necessary.
I just would like you to come and stay on some. Go at night sometimes.
Cody, come on over to the farm. Welcome anytime.
That's actually.
Not Benny. I just thought it was great. You're my Matthew McConaughey.
One other thing I'd like us to be able to do if we are one of our goals is to revisit our past recommendations. Trevor, I would like to task you with creating a summary going back to when the board started
Oh, yeah,
to present of all recommendations that we've made.
color coded.
I believe the one that you had earlier last month was of the recommendations of 2025.
And honestly, even
So
if
I
you
think-
just gathered like all the letters that we sent with the recommendations in them,
Sure.
that would be enough. You don't gotta put some new spreadsheet together.
Yeah.
I think we can all effectively
Yeah.
read the documents. I just don't wanna miss anything that we've done in the past. And look, it might just be as easy as saying, making a motion that we reaffirm all prior recommendations. But we may want to revisit some of them because some of them we may need to massage a little bit to make them palatable.
Sure.
And I want a full transaction history of everything that he's ever said.
I was actually,
Everything or just here?
Just kidding.
Alphabet.
can we get statistics and numbers of patients that we're losing in the program each month? Is
Do
that
we
a
pull-
possibility?
pull
We have that in the monthly report,
Okay,
and if you like something else besides
Yeah,
what's in
no.
there, and that's posted on the,
is
on
it?
the.
No, but that's.
Can that
maybe
just
something
be
we
part
can
of your
discuss.
report
Let's hear
anyway,
it.
just to give that number?
Yeah, that's in the monthly report already, and
We can.
we can include that, and UDAP could include it in the future.
Yeah.
And when you gave that number today of, X number of patients, like the program grew by X number of patients, that takes into account the attrition and the growth, right? That's the.
Oh, yeah, that's like total
yeah,
number
that's
of
the number, yeah.
patients. at the-
You're getting that every month of how many like, that's the total number of patients the program increase, it's the net between.
Right,
increasing.
yeah, I wanna see I wanna see how many we're actually losing.
We've lost upwards of 70, north of 75,000 from the beginning. You're tracking it. I don't know how close we are to 80, but maybe we're closer to 77. I'd have to look. Yeah, that's the hard part. There's some noise in there for sure, so it's not completely accurate, but yeah, you've lost more than 70,000 patients since the program began in total. So you're at 110. So if you look at it, I mean, yeah, I mean, you're probably, you're gonna be a little bit shy of that, but yeah, that's always the thing is the attrition, right? And I mean, and there's many reasons for attrition too. It's not all just one
Trevor,
reason.
do you know what that looks like in other states? Is that common or is Utah?
The attrition rate,
Yeah.
that would take a lot of time to gather. I don't know how many.
Just didn't know if like anybody talked about that.
I can tell you, so comes up in every single board that I'm on. And we're pretty similar for medical states,
Really?
yeah.
That's not helpful.
By the way, the complaints that happen here are the same complaints that happen everywhere. So like, price is one of the bigger issues, Mississippi's the latest one that we've had a lot of this on, but it's, but their testing is now becoming more rigorous, and so.
Yeah.
It's right, like you want safe stuff or, cause they had a big problem with everything coming in from Oklahoma, so. So they were finding all kinds of amazing things in their cannabis, and so they've increased the testing standard. But it increased the price.
Oh,
Can I throw in another suggestion for next?
yes, I love suggestions.
At least finding out the process to see what the statistics are. How many times. Law enforcement is seizing and citing or arresting. From. Card holders versus how many times they're, I guess we'll say the positive interaction where they're being released with no action.
Okay,
Because I think that those numbers. Assuming that they're good, because per my experience. I'm not stopping a lot of people with cards, but. If those numbers are good, it could really help with a lot of, I think it can help with legislature seeing that people. That are participating are complying and it's not just turned into a raid.
I can tell you this, my interaction with law enforcement in like Salt Lake and all the surrounding areas. Is very different from my interactions with law enforcement at Cedar City.
rural is still very much, this is like, yeah, this is a drug, yeah, but.
It's still a truck, and that's very good.
You know where we would find that information?
That's why I wanted, like, I'll try and look into how we can even go about that because.
I believe the former law enforcement officer on the board, Jimmy Higgs, tried to work with DPS. He's employed there to get statistics about interactions related to medical cannabis, but I'm not sure he was ever successful. Because I don't know if there's any uniform reporting on it. So.
By the way, this is significant. It goes beyond this for the biggest reason of this. So everyone's seen the latest like New York Times article about their reversal of their plan. If you look at every one of those studies, they never involve a medical cannabis program. It's any cannabis that they happen to run into, right? Which is not a true indicator of what is happening with cannabis, right? Oh, it turns out that dirt weed has a lot of health implications. Well, yeah, everyone in here would probably agree with that. So like that's not meaning that, you know, cannabis has changed. It just means like how we perceive data. And it actually hurts the system and it hurts trying to do better work when, oh yeah, nationally now everyone's changing their opinion on cannabis. That's not true. That's actually not how that works. And that's not good data either.
Just follow the money who's paying for those studies. There's a certain group right now
Yeah.
that's very fearful. Look, it's no different than
Yeah.
the 1915s, the 1930s, right? That was DuPont. That was William Randolph Hearst. Now it's the alcohol companies,
is
right?
the
Alcohol is getting their lunch eaten by cannabis and they're paying for a lot of these studies. They were behind the federal hemp ban. You know, they're behind a whole lot of things. So, you know, take it all with a grain of salt. You know what I mean? But that's just another reason that we need to get to a place where we can allow for the real research too, instead of just, you know, reviewing research, you know, studies and cherry picking which ones you look at and everything too, because, you know, you can always get to the result you want, you know, when you do this stuff. So just, I mean, just tells you gotta keep fighting. There's just new enemies. It's just, you know, it's just three for madness, what, 3.0, 4.0, who knows which one it is.
You quickly pull up the tracker, the new sheet, and I just want to relook at it.
Needs to be
Just throw-
Oh, yeah.
Yeah, just throw any notes on there, so when Annette and I go into our planning session. If you guys
We're
would
gonna both
just,
show up.
would you just look at this one more time, and these are the 6 things that we put on there for, our goals. If you have anything that, like, if we, you know, look at safety and quality, for me, that's super important to, you know, keep that up while keeping costs down, right? So just anything that you guys can see in each one of those, increase the patient count, looking at why people come off, just any pieces that you would like to add to that. So when Nanette and I go into our planning session in a couple of days, then we can make sure that we get the right, items maybe ready for discussion. Is there anything you'd like to add?
Nope, next meeting, so on the agenda will also be mission.
Yeah. Oh, yeah, but the mission vision.
How can we educate ourselves as a board to become more efficient, making the transition from recommendations to bill production or the bill drafting?
And
Are there resources? Is there an expert?
we have had a really, like, and that's,
rock
I don't think.
Yes, say, I'm just a bill on Capitol Hill.
Yeah.
Sincerely, I mean,
Yeah, no, we did really well. I think we have to fine tune our game this year. And I think one thing that I think we need to do is create these subcommittees, and like JD recommended today, having maybe like a legislative affairs subcommittee, people that are after every, you know, maybe every quarter, every 3 months, whatever, we go back to them and then, like Blake said, put the drafting attorney in those emails. And so everyone is aware, because we had a lot of things in there that fell through the cracks. I also think we need to have our bills. I say this like I have the ability, but the bill is in the hands of the sponsor. And so where we got kind of sign off or what appeared to be a yes on some things, when they were weighing it against other things that they needed to pass politically, cannabis lost out. It seems to me what happened. It wasn't lost out to other cannabis things, it was lost out to other important political things. And so, I think we need to try to have those drafted earlier. And so it's just not in the mix of everything. Maybe it's a little bit easier. But I can't force that to happen. We can just kind of be the squeaky wheel. I don't know if JD has anything to offer there, but
I
that's
think
what I'm
too,
thinking.
that the more specific our recommendations can be in terms of here's the legislative language that we would propose, which further down the track. But look, cannabis is likely never to be an issue that someone gets elected or not elected over. There's a very small group of lawmakers who control that right now. So I think thinking how we create greater influence just other than ourselves, because I think we had a lot of momentum and a lot of things were in bills you know, in the first couple of years of our board. This year, not so much. So I think we have to think about how we can help to convince them. But I think some of it is we make these great recommendations all year long. And then we get to the session or even before the session and it's like, well, here they are, you know, we're sending them these letters and everything too. I just think we gotta have some better follow-up and some things too, but a lot of it is we need to know who to target and some of those things. So I think that's some of the stuff we should be working on in these meetings is not always just what's the next agenda item for recommendation? Having working sessions about like, hey, you're going to do this, I'm going to do this. If we can't form the subcommittees and make them effective, we need to make the board into essentially a subcommittee.
Yeah.
And maybe every other month, it's, 45 minutes to an hour for just legislative affairs and like, okay, where are we moving these things? Cause look, I think we can recycle a lot of the recommendations we already
Yeah.
made and then figure out how we better push those along
Well,
to lawmakers stuff. But it's also difficult because to Dez's point, there's a lot that happens politically that doesn't have anything to do with cannabis, or they may fear that a certain issue is too controversial and it may jeopardize the entire bill and stuff too. So some of it would be good to familiarize yourself with the people on the working group, but also the people that are that are on the committees that are gonna be voting on this. And it goes in front of literally, Brandon Cody can tell you this, same two committees every single year. Ag in the House, Health and Human Services in the Senate. You might see labor and employment every once in a while and whatever, like I remember or tax and rev when the 280E credit bill. But for the most part, these bills are going through the same committees because members of the Cannabis Governance Working Group sit on those boards, right? So that's where they're being directed to, and they seem to flow that way too, just generally, right? So it all kind of works out that way. But familiarize yourself with those people and reach out to them, have conversations. Because I think one of the things you find with cannabis is you have to educate them to get them to like the starting line, and then we can talk through the policy. So like, I think you would be able to, from your perspective, or any of you from your own perspective, even from a public perspective, help them to understand where you're coming from and that you sit on the board and just try to further legitimize what it is that we do. Because it sounds like we're gonna get pushed down the totem pole one step further, with this new licensing board coming in. Now, there's a couple of layers we have to go through before we can get to, lawmakers. So I just familiarize yourself with that. But again, a lot of it is just consistency. And again, so much of it is that there's still a lot of misconceptions around it. And there's still a lot of other people, and we probably need to go into the lion's den a little bit. We've had, Walt Plum here, but we may need to talk to the UMA and some of those folks as well, right? And help to understand where they're coming from, but help them understand like what we're trying to do. Because I think sometimes it comes off as, oh, you're trying to put it in the hands of kids, or you're just trying to make it so everyone can get it for no real reason and whatever. You guys all know that's not the truth, right? You know what I mean? This is a well-regulated program, and all the statistics I've been waiting on for someone to show me, I've never seen. So I think that's a great place to start, but I do think we should start using this meeting as some working sessions and not just prepared agenda topics, every single time, just a little more freeform. And then I think we get to a place where we are like, okay, these are the ideas we like, then we can agendize those for decision making. But I think if we make a bunch of great decisions and we don't know how to properly communicate those to put them in a bill and pass, that's hard. And I think it's also too hard to rely on just the chair and the vice chair to carry the water too.
To just clear up one of JD's points, that is something that we can do, is sometimes working with opposition can just take so much time, but if we go, so like this year, for instance, I went to all of the people in the working group and some of the people outside and talked to them about, the removal of the compassionate use board and what that would look like. And everybody on the working group was a little uneasy. But there was only a couple of them that were hard no. And so I was like, you know what, that's okay. We're gonna educate during this interim. But to JD's point, when we are educating the working group, if we are also including the UMA, and then we go to them and they're like, hey, we've got the UMA on board, which may never happen. But if we work with the opposition and we come to an agreement with them somehow and then give that to the working group, we have a much better chance of it ending up in a bill, and they're much more likely to put something in a bill if it's going to sail through easily. They're not gonna have to fight for it tooth and nail while they have 200 other bills they're working on. And so I think he's right. I need to be better about inviting opposition every single time. And telling them what we're gonna be talking about. And if they know, they'll probably show up more often, at least on the times that it's interesting to them. And then if we can come to an agreement together, it doesn't have to be in the meeting, but sometime before the general session next year, I think we have a way better chance of ending up in a bill. It's really hard for them to spend all of their capital fighting for one little piece of a cannabis bill when they have 100 other really
Sure.
important things. And so making this just a smoother process is key. And I do think that we could do big things like the removal of the compassionate use board and a couple of those other things with time and consistency. So I think I love the idea of the board kind of taking that direction.
What I think it will also help to encourage communication between this new committee.
Yeah.
The existing committees. As well as transparency
Yeah.
between the groups.
Yeah, and just getting to know them, inviting them in, like, when we're talking about studies, they should be texting you about it, like,
Yeah.
that you should be their resource. That's what we're supposed to be, is their resource, and so we're here, and I think it's very easy for a board to just kind of be a board that reports, we need to be more assertive in making sure that we're part of the team,
Right.
so. Sounds fun. Yeah, we can keep beating that horse if you want, or we can take another motion.
Motion to adjourn?
Do we need to talk about anything?
It was
I
time.
feel like I've been talking for 88 years about things.
Right.
I